to to have this in January, to have our brown bag and to resume our activities for 2025. However, it was busy month. I can see a lot of people are joining. I will give it another 1 minute, Maria, then we can start. Maybe people can, okay.
That sounds good because we have people coming in, so maybe we'll give it a few minutes just for everyone to join.
Dr. Salman, we will just give it another 1 minute for more people to join us.
Okay, take your time. No problem. I'm trying to find the share. Oh, here.
So, hello everyone. Welcome back to the Brown Bag series and Happy New Year. We decided to start or to resume our brown bag with the godfather of public health and public health policies. We have an amazing and distinguished public health expert. And I think most of you either worked with Dr. Salman, worked with him, either worked with him or heard about him or inspired by him directly or indirectly. So today we have Professor Salman Rawaf. He is a leading public health expert and he is the director of WHO Collaborating Center at Imperial College, as well as the director of Arab Public Health Association and the International Association of Medical College. Dr. Salman has more than 360 peer-reviewed researches. Dr. Salman, he supported WHO a lot during the last 30 years in designing public health policies, supporting governments, as well as how to build the capacities at a national and a regional level. I would say, it's the right timing for this topic. Dr. Salman today would walk us through capacity building of the local leadership in disaster response. And the way I'm saying is the right timing after what happened and Trump and withdrawal of American fund from humanitarian assistance, I think it's the right moment to take this as an opportunity, how we can build the capacity of our local leadership, how we can think differently. We shouldn't look at it as a disaster, but I would say as an opportunity to start focusing on our local leadership and ownership of public health response to disasters and emergencies. With that, I'm very glad to give the floor to Dr. Salman Rawaf. And me personally, I'm super excited for this webinar, and I think many of you are the same. Dr. Salman, over to you.
Thank you very much, Dr. Summer, for the kind introduction. I'm really very grateful to be with you. And good morning, good afternoon, good evening, everyone, wherever you are. I think when we are talking about disaster response, it's become now, since the COVID-19, really a major issue for policymaker, decision maker, for researchers, for almost everyone in healthcare, those who are providing direct services and indirect services. I think it's, as Dr. Samar said, it's timely now, especially taking into account some of the political changes and the circumstances happening around the world. And indeed, in some regions, including Eastern Mediterranean region, we have many sort of emergency situation. Preparing the leaders, current leader and future leader, who would help us as a people living in security, living in peace, and able to respond to any emergencies, small or big. So we have an opportunity to share between us some of the ideas and learn from each other. This is not about individuals, leading the agenda. This is about everyone should prepare and be part of the response team in collective way and responsible way. Let me go through the journey, and I am really, really very grateful for Celine and the rest of my team for the excellent work. Okay. How do we integrate national issues with local disaster response team? As you know, in many countries, we have what is called the national team, as well as we have the local team. And very few countries manage actually to integrate these teams, unfortunately. I remember when I was director of public health for 23 years, I used to have local and national responsibility for emergency responses. And we always talked at that time, I'm talking about a few years back, we talked at that time, finding the mechanism by which the national team, look at the local team as part and parcel. And the people at local level should feel very comfortable that they are part of the national response. This is not about hierarchy. It's about, and I'm using a term here deliberately, about a collective responsibility. So these teams, they need to think about collective responsibility. And we'll show you later in terms of our training program, which we did in the Kingdom of Saudi Arabia. We focused on that point, for the trainer of future team members. Okay. If we ask why the integration is important, then we have to say that local rapid response team, they are on the ground, they know exactly what's happening. And a good RRT, rapid response team, should really fully verse with the local circumstances of its locality. He knows the institution, the services, and how these actually work. This will help the national team, and this local specialized services will help the national one and jointly making the right decision. We need to remember that all the time. Okay. Efficiency is very important in terms of resource utilization. And of course, as I said earlier, is about better coordination. At the end of the day, it's the issue of quality important here. And let me emphasize, is the quality of the work, because this is not something you could just to provide and move away. This is about the life of the people you serve. Because simple mistake, it may cause the life of hundreds of people, maybe thousands of people. And we can give you example, actually, about this from a variety of experiences happening around the world. Okay? Okay. Again, how to sustain skills. And I tell you from my experience in EMRO, when we train variety of team members, and I tried to follow up these members, what happened to them. I found after 6 months, almost half of them disappeared. They went into another job. And this is a problem, by the way, not only in Eastern Mediterranean region. It's a global problem because of the career structure, because of the way government and health systems looking after these specialized teams, And I give you example, analogy from medicine. When you're talking about cardiac surgery team, these are highly specialized team. Those are doing a transplant or doing heart surgery for 10 hours, 8 hours, whatever, Such team require many years to develop. So we in the health service, we have to look at these teams. We shouldn't read them, like any other team anywhere. These are highly specialized, and we need to use the term that actually the emergency response teams are highly specialized. They need to deserve that title, and indeed they should have such a title. Sustainable skill actually mean flexibility in increasing the input, i.e. the services, or decreasing it, depend on the demand, depend on situation, etc. And that flexibility is very important. And people within these teams are trained, and we need to maintain that, Again, it's remind me of some of the work which we did with our emergency response teams in London. We used to involve a team which is highly specialized in small exercises, just a small exercises. For example, meningitis outbreak in school. And sometimes they ask me, they said, look, this is peanuts. I said, yes, but we need to learn how we respond very quickly so we don't delay or we do a mistake. It's about how to scale things down and how to scale it up. So you need to think about this in terms of the drill, in terms of the exercises, because we need to have different situation, etc. I mean, not like that, not in April last year, there was an excellent meeting from by WHO and colleagues from the Public Health Institute in Ethiopia, and looking at how we integrate the local response team into the national emergency teams. And if you look at that actually meeting, there are three takeaways. There are many takeaways. Let us look at the three of these. It's really about how to enhance efficiency, coordination, and utilization of the limited resources we have. How can we benchmark, measure of success? And from that, identifying priorities of tasks which need to be undertaken in situation once we are integrated. And the most important things to me is the need for leadership and sustained funding. And I'm very pleased WHO IMRO is one of the leading regional offices across the globe, which started training and leadership program for emergency workforce. And the work of the last few years now evaluated by Dr. Samar and Dr. Saline and other colleagues, and it will be published soon. It's a great achievement and well done. Fantastic work, and I hope Dr. Samar, once is available, once published, hopefully will be shared widely with colleagues and the people who are actually with us today. And this is some of the screenshots and whatever they are, from that Addis Ababa meeting last April. CDC, although now they are trying to isolate CDC from us around the world, Unfortunately, some political decision, we don't know how wise they are. So develop some documentation on training and integration of RRT. They did some fantastic work. And this document is actually focusing on variety of issues, but in particular on leadership training. And these leadership training programs, they are quite similar, by the way. We have been running a leadership program, including emergency. We did run it with WHO Geneva in headquarters in Egypt some years back. And we've been running it for 20 years. So as other colleagues. Okay. Let me take you the example which I mentioned about our work at the Kingdom of Saudi Arabia in training. Somebody opened the mic, and they must have a party. Yeah, thank you. So we were very privileged, invited by colleagues from the Ministry of Health, the Kingdom of Saudi Arabia, to train the trainers in rapid response teams. And it was a great opportunity to meet such dedicated people. And we are very pleased that program is very successful. And currently we are evaluating this. Started in September 2023, 1.5 years ago. Actually, the goal of that program is training the trainer, basically. A number of colleagues join us in that program. And once they finish the training, which was about 1 week, 4 of us went to the Kingdom of Saudi Arabia. And in that workshop, which is meant to be, they continue the training, about 270 rapid response teams across the very vast geographical area of the kingdom. The highlight in that workshop from Marianne, what is written here, is basically about adapting to the local situation. And that is really very important. And the question for everyone was, because we brought them from different parts of the country, what is the word adaptation means to you? How much you are well versed with the local situation, because you need to be very careful, because sometimes, we do this work as a job, like somebody sending me to clean the window of this hotel. I'm in Erbil. I just clean it, and I don't even notice how many rooms in the hotel. That is not for the emergency response team. You need to love what you are doing. You need to believe that you are saving life. You need to believe that you are the protector of the people. And therefore, you have to know what is the local situation. The geography, the population, the diversity, etc., the obstacle, the resources available which you may need during emergency, from vehicle, from this, from that, etc. The sort of stakeholders you are actually going to coordinate with. You have to have that big picture. This is not, I keep saying this, this is not a 9-to-5 job. You need to think about it very carefully if you are in that position, And that, of course, including the facilities and the resources available with the health system. So part of this idea that understanding the local situation, you need to be versed in conducting or relying on people able to help you in conduct need assessment. So and this is not easy, by the way, but you have to enable yourself to get that picture, which I mentioned, through assessing the need of the population you are going to serve, So that means fostering some cross-cultural understanding and fit it to the emergency response agenda. You see, that's the beauty of it. See, and that, to be very honest with you, that's the beauty of public health. Because we look at the big picture. There is something much more beautiful than the narrow things. I'm a clinician. I'm very good in treating a patient. That's not difficult. But when you look at the entire population, you know, the beauty will become totally different and become much more interesting and much more challenging. As somebody was saying, the heart will start to grow. Okay? That's the love of what we are doing, you know. So that week which we spent there, because 3 intensive days for the trainers and 2 other days for other things, we gave almost the concept and philosophy of teaching and adult learning. And you need to know not everyone is good in training other until he or she is familiarize himself or herself with what adults need to learn and how adults learn. This is different than teaching children, etc. And majority of the colleagues who join us, they are actually quite experienced and worked in the health sector for many, many years. Some of them, although new to the emergency response planning, preparation, and response, but yet they were adapted very well. And we were not easy with them. We focused on the non-technical skills as well. Let us call it soft skills in leadership, because we felt these are very important. Issues like writing, issues like listening skills, issues like communication skills, because they will be trainers. They will train other people. So this is not about themselves alone, but in taking wider responsibility in training other people. And these are very, very tailored training program, because while we are actually conducting the course, we change the program about 4 or 5 times. Even sometime with the greatness of Celine and the other colleague, Professor Atwan and Dr. Mays, we manage literally on the hoof preparing an exercise very quickly, because when we realized that, you know, the attention span is lower, or they felt a little bit tired, we were pushing different agenda and raising the interest. So that required a lot of facilitation skills, I must say, and the team did extremely well in that. And we looked at the, as a trainer, is important, they look at the training needs and how to assess that, and also how to evaluate the impact, because they will be responsible for now hundreds, maybe thousands of people across the country. And while they were doing it, by the way, we did monitor it. We took sample of this and we gave them feedback. So it was almost a continuous process. Here we are. These are the trainers. And we were sitting on the, now it looks the right or left side of the picture. I don't know how the image you see it, you know. They look, all of them, smiling. I think this was the second day we decided to take a photo while they are fresh. Enhancing local leadership in emergency preparedness is an issue actually close to my heart, and this is, to me, is something really very important. First and foremost, everyone is a leader, and everyone must take that leadership role. Nobody should say, look, I should leave it to the RD, I should leave it to the minister, I should leave it to the deputy minister. This is not true. You see, in Arabic, we have say, كلكم راع وكلكم مسؤول عن رعيته. Everyone is a leader and everyone is responsible for his or her people. Whatever, it may be your small family, it may be your small community, it may be your entire nation. So I just want to emphasize on this because it's so important. And therefore, every one of us need to prepare himself or herself to the leadership role. You know, everyone need to understand, what is my leadership style? Am I somebody just dictating? Somebody just delegating hundreds of things? Can I change my leadership style, depending on the situation and the issue? These are questions we need to ask ourselves, you know. And we don't need to ask why strong leadership is actually matter. Of course it's matter, you know, because sometime you will be the first one who respond to emergency situation. Sometime you are the only one there. Nobody is available or you cannot reach. So you need to act. You cannot say, sorry, this is not my responsibility. This is not about everybody's business, nobody's business. You know? And this is something people, I don't know whether we can put it in a job description, etc., or we can discuss it with people who are engaging or interested in emergency response. But it's very important that you take that responsibility and you take that leadership role. So we say that local leaders must be able to assess the risk immediately and the response capacity, ability to coordinate, you know, even if you are alone, you know, the information you collect to the stakeholder for engagement, to the public for warning and information. Tell them, you know, don't wait. And I remember, without mentioning it, in a small Arabic country, I was sitting with the director of public health. And then this is during the pandemic flu some years back. And a case was admitted to the hospital. And the minister decided not to announce it. You know? So he and I rushed to the minister office and said, no, you should announce it. He said, no. I said, look, it's already in the media, you know. And he was forced to announce it. Again, in a large Arab country during COVID, the minister decided not to give sufficient information about the status of COVID in that country, which was, of course, a mistake. I was with colleagues at WHO EMRO, COVID coordinating committee under the leadership of the RD. And we really advise that you should really open to the public. And that is a leadership role. Public must be informed and engaged. They are at the heart of everything we do. And this is about the transparency, etc. We cannot hide anything nowadays. There is no point in hiding things. And this will help us, of course, to mobilize whatever resources available in the community and beyond, and sometime international, you know, and implement the policies which we prepared in advance as part of the preparation. We do whatever we can to push that agenda in the right direction. Okay, so when you look at the building local leadership, you know, Al-Asal, which is, I'm sure you know about it, the arid, semi-arid lands, etc., humanitarian network, They are very good in help fostering local leadership in disaster response. There is example from Kenya, which we have. You will see it in the references. And actually in about 10 counties in Kenya, in a beautiful way, they share information, coordinate in local and national response, and pushing that agenda for support from many, many stakeholders. I mean, it's nice selected here some topics like climate change adaptation, food security, women rights, etc. These all areas of expertise, they bring it all together in terms of the emergency response. Okay, uh, uh, I think I would advise you look at that reference. It's quite interesting reading, and these are the sort of stakeholder you find, and in terms of how they support the community. We brought that example because it's really linking beautifully the local with national. And this is all about the things which we are talking about. So we have a good example, which we can learn from it, and we can build on it and develop even better example for other people to share. And by the way, it's always opportunity. If you are doing something good and you know it is good, don't keep it yourself. There is no point. Share it, please, because each of you is a lovely resource, beautiful resources, which we need to learn about it. And those people who want to publish it or put in an article and they found some difficulties, contact Samar, contact Dr. Samar, contact Dr. Celine, approach us, contact me. We would be more than happy to help, you know. Sustaining and sustainable strategies for leadership development, when we look at these, you know, first of all, you have to have a permanent leadership training program. This is not as something which we call it one-off experience. It doesn't work like this, okay? We have to develop program which is continuously developed. If you look at the NHS in the United Kingdom, they have an authority responsible for leadership training. I mean, when I was a consultant pediatrician and I was offered to do the executive MBA, you know, before I took responsibility as a medical director, then a chief executive, then director of health, you know, these training programs were offered to everyone, you know, because they were looking for people leading in the health system. You see, it's always surprised me, and you may find this statement questionable. It's always surprised me that somebody given responsibilities such as managing a hospital or managing big health institution with a huge budget without any training in leadership and health management. How on earth I accept that? You know, it's exactly like somebody giving me a set of skiing, you know, a boot and a ski board and asking me to go on a ski. How do I do it? You know, I remember I met in Cairo 6 people attending a conference from outside Egypt on hospital management. And I did have the pleasure in meeting them and having a dinner. And we were chatting. They are given responsibility recently of large hospitals in their countries, different countries. And none of them have any training in health service management. The only qualification which gave them that post is they are doctors. Well, I said, that's good, not good enough. You know, because you need to understand the issues of finance, the issues of governance, the issues of managing people, the issues of communication, listening, etc., etc., etc. Anyway, even organizational theory is important things. We talked about public participation because in emergency, the public is there. So that public participation, we need to take it to the drill status as well. We shouldn't do drill between us alone. I've been involved in many drills in London and across the UK. Actually, the public actively engage in it. The actors were public, the people. For example, having a chemical release in the underground, or a nuclear attack, or airplane crash. We always train about airplane crash. It did happen, unfortunately, recently in Washington, D.C. All of you saw it on television, etc. So the public participation is important. And we are, and they will be, advocate for government resources to be allocated to emergency leadership training. We have to push for that agenda. The government need to have a dedicated budget for the leadership training, including number one, emergency leadership. And of course, as Dr. Samaran said, Dr. Celine did, evaluating of what we did in the past emergencies, always we do that. We look back at what happened, etc., and we adapt the training, we adapt the decision-making process, we adapt the emergency plan, we adapt to this and that. So it's good opportunities when we look at M&E monitoring and evaluation, and we adapt to create something which is totally different. I think I will stop here, but before I'll do that, because I'll give more space to discussion, learning from you. I think one of the important things about emergency planning and response, it's really something across my career. I always ask question about the small emergency, local emergencies, and big emergencies. The small emergencies, because I'm a frequent flyer, and as a physician, I have to prepare myself to any emergency in the airplane. So I studied all the possible scenarios, from heart attack, stroke, even a fall in the airplane, and what should I do? Because I have two options. Sitting in the plane and the captain will announce, is there any doctor? Luckily, most of the people say yes, and actually they got a PhD. They don't have qualification in medicine, But anyway, I remember I attended 2 or 3 patients in my lifetime as emergency in the airplane, but I didn't have the opportunity to divert an airplane as one of the registrar. Actually, she was registrar in emergency medicine, who was on a flight to United States, and there was an emergency, and she advised the captain to redirect the plane, and he did, and she saved the life of that patient. It's well documented. The big emergencies happening sometime without knowing. And we notice what happened in Syria and Turkey with the earthquake. What's happened in actually LA with the wildfire, what happened in recent unfortunate emergency. I mentioned it in Washington, D.C. And that could happen anytime, every time. So I beg every one of you and you to cascade that message that all health workers within the system, associated to the system, that serve the country, should be versed and adapt to emergency situation, small maybe or large maybe, at local or national. And indeed, we can say international. And thank you very much for your time and listening. I'm happy to answer any question I can, and I will lean on the help of Dr. Samar and Dr. Salim. Thank you very much. You are muted.
Thank you so much. Just a minute, sorry.
Yeah, we can hear you.
Yeah, no. So thank you so much, Dr. Salman. Actually, that's how a smooth leader he is. So you showed leadership very smoothly. I was smiling the whole time with all the examples you brought to the table. You walked us through all types of emergencies, from conflicts, floods, earthquakes, um, humanitarian outbreaks from LA, Washington, D.C., Syria, Ethiopia, Turkey, and so on. You said very important things about leadership and transparency. And I think during this time, especially, and all the uncertainties in the humanitarian response and all of that, I feel transparency is very important and we should be very transparent. The second thing, which I really liked it, and I always advocate for that, everyone is a leader. Everyone can do a change. Just decide, just believe in yourself. You can do a change. Every one of you. I just need people to believe in that. And thank you so much to echo that. Hearing that from a successful, true leader like you, I'm sure it will inspire all of them. The third thing, it's about the sustainability and the local leadership. I think localization is a must, is not a choice anymore. And we should advocate for localization at every single discussion on every single project. And when I say localization, I will go also to the relationship between national and international staff too. We are international to build the capacity of national people and to empower them and to make them empowered to lead the emergency response in their countries. Please always remember that. I wouldn't take so much from the participants' time. I'm sure they need and they have a lot of questions and queries. So I will give the floor to them. If you can raise your hand, please. So
Samar, we have two hands already. Yeah.
Two
Maybe
people.
we
I will
can
give the floor
yeah.
to Maria to manage that. Maria, over to you.
Thank you. Thank you so much, Professor Salman, for this presentation. And we really appreciate your expertise. We have some questions in the chat. So maybe we can start with the first question that was posed from Ukraine. What are the key professional competencies that the public health leader on emergency management should be equipped with? That's from Natalia from Ukraine.
Thank you very much. I mean, Ukraine is the biggest emergency situation we have actually across Europe. It's very unfortunate that people losing their life. You see, the competencies is well defined. We were involved recently in defining the competencies for public health and emergency workforce, you know. And I just want to focus on three important things, you know. One important skill which you need as a leader is ability to listen, you know. Listening skill is something majority of the professional, especially health professional. And if you look at patients' complaint, for example, majority of it, you know, and I dealt with such complaint for years, you know, majority of it about communication skills, because the doctors or the nurse, they don't listen. They said, look, I told them this, but they are not listening, you know, and a good leader must be a good listener, must be a woman or a man of few words, you know. It's not about dominating. This is about
being the master, but the master who served the people. So you are the servant of the people through your mastership. Okay. The second important skill which you need is really the ability to adapt your leadership style. We have exercise which is called situational leadership, because if you look at leadership style, there are 4 leadership styles exist, which is number 1 is the directing, which is like a dictatorship. We don't want to mention name close to Ukraine, and you are surrounded by those people across Europe. You have the second type of style is participating, ability to participate. The common style, which is a lot of leaders use, is selling. People try to convince people. I like a salesman, convincing people and doing the right things. Again, Europe, we have a lot of companies are very good in selling, expertise and experience. The complex one, which you see it in IMRO region we tested, is missing, is delegation. The ability to delegate responsibilities to others. These competencies are very important, but to do so, you have to assess your leadership style. So at least you know who you are and how you should change that style, And I can give you a lot of examples from other people. The other important point, and one need to look at it and look at it very, very carefully in leadership style, is understanding the issue of organization and how organization are actually managed and why different organization having different management structure and management style leading to different governance. There are certain organizations which is managed through what is called hierarchy. The reason understanding this is because you are dealing with variety of stakeholders. Each one has its own culture, its own ability to run things in different way, So you need to be very careful and just picking by talking to a person, my God, this is a Weber style of organization. This is a human relation type of organization. I can really reach to the top. Here I cannot reach to the top. I just mentioned 3. As I said, we can't give you the link. I don't know, Celine, with us or not. We can actually give you the link to the WHO website, which is identifying all the competencies needed for a leadership within emergency response. And as I said, this is applied to every person. Everyone's a leader. Thank you.
Thank you for that response. There's another question in the Q&A section. How can communication between local teams and national emergency response teams be effectively enhanced?
This needs a good governance. And let me give you the example from the UK. I don't know whether we have colleagues from the UK apart from Rachel, I can see her. And you see, in the UK, it's structured as command and control. So at local level, we call it bronze. Okay, could be a local hospital, could be a local institution, whatever. This is the bronze. And then you have it at a locality, which is, say, a district or a governorate. And we call it silver. All right. So across London, we have emergency response team, command and control center, which is silver. At my local level, which is the area, some of the 4 or 5 hospitals, etc., whoever responsible for it, this is a bronze. And then the national level, which is headed by the prime minister. In our case, it could be the president. In other countries, it's like the chief of staff or whatever, and that is gold. And once you are actually identify the governance, i.e. how the link is happening between the national, local, and organizational, then defining that as part of the planning process, the communication is very easy. On the 2005, at about 7:24 a.m. in the morning. At that time, we didn't have much of the smartphone, which all came 2014. I receive a trigger on my Bleep, which is saying there is underground surge, electric surge. And within 5 minutes, I receive another message, we have second attack on the underground. I immediately realized this is a terrorist attack. And of course, the third one and the fourth one happened. And I have to prepare immediately all my hospitals, etc. And we have the hospital is classified to different type of organization, depend on the size and the function. And we have actually very large hospital with helipad, etc. I immediately evacuated part of that hospital, preparing to receive casualties, And the message immediately came from the center to the London-wide to the locality. And each of one took action. It depends where we are located from the incident happened. I mean, that literally speaking, within a few minutes, everything was ready, because we are trained, we have the plan, we have a strong governance arrangement. That doesn't mean we don't get it wrong, but at least that relationship is depend on the governance and how you set it up. Thank you.
I see we have a raised hand from Rafiullah, and he also asked a question in the chat, or it's she. Rafiullah, can you unmute yourself and ask your question? I see a raised hand.
Yeah, here it is. You are muted. Rafiullah, you are muted.
Hello. Hello,
Hi.
doctor. I am
Hi.
Rafiullah Khan. Hi,
Hello.
Assalamu alaikum. I am from Pakistan.
Hello, hi.
And I am working
Which part of Pakistan? Which part of Pakistan?
From Khyber Pakhtunkhwa, which is mostly vulnerable and the disaster hit area in all 4 provinces. So I have worked for 5 years as a manager of emergency department in one of the biggest hospital of the subcontinent, which is Lady Reading Hospital, Peshawar, and where we are dealing more than 4,000 emergencies around the clock, including different disaster scenarios, different bomb blast, floods, terrorist activities victims across the border, even from Afghanistan. Nowadays, I am working at a divisional head of the pre-hospital emergency services, which is Rescue 1122. It is governed by the government sector. My question is that we are facing so many gaps between the pre-hospital emergency services and the hospital emergency department. Would you like to guide me that what type of intervention we must acquire to bring the governance structure and the leadership issues on a table and to address it for the sake of humanity? Thank you.
Thank you very much. I'm really glad that you asked this question, because I need to clarify one thing, and I need to mention a point which I missed to mention, and I apologize for it. Let me start with the second part, which is my point, which I should mention, whether we should integrate emergency services, which is affecting wider population, with health emergencies, which is affecting individual, for example, somebody with a stroke or coronary heart disease or fall or multiple car accident, etc. This is an issue really now for discussion, and many people from practical experience saying we should merge the two. So while the first one, which is called the pre-hospital emergency services, is things could happen to the wider community, there is a lot of sense to merge the two together, because even in national emergencies or local emergencies, for example, crash two trains or fire or major things, the response, the hospital emergency will be involved in it eventually, and that should be part of the plan. Most of the work now is talking about merging the two. You see, one of the things which is we discovered and we learned from COVID, our COVID experience, that primary care doctors and nurses and all other staff, which is contributing fantastic work to the population health, were not involved in the training. Very few emergency departments, only those dealing with major trauma, emergency type of department, were involved in the national emergencies and local emergencies training. And that should change. And I'm really glad there is that question. So answering your question, you need to find a mechanism of merging the two, making sure they are able to respond together, the pre-hospital and the hospital emergency responses. But at the same time, you need to differentiate between the two. For example, the blue light emergencies, etc. These are one-to-one, small scale. They can deal with it quite easily. But we were talking about the larger scale affecting multiple people. Thank you. Excellent question.
I think we will need to wrap up, but there's a last question that was asked twice. I will make a summary of a question. It was asked by two participants, the same question. So what are the effective ways to involve local communities in disaster preparedness while minimizing fear and anxiety? Additionally, how can their participation be optimized in emergency response efforts?
I mean, this is always a big question, and people talking about engagement of the community, involvement of the community, and no one is defining the mechanisms. I mean, first and foremost, if there are any research people can share it with us, they are welcome. I mean, from my experience was give them the weapon they need, and the weapon here is health literacy. Give them the information in advance. Talk about what does it mean by emergencies at a large scale. A lot of people, to be very honest with you, even in a school, we don't teach children how to respond to emergencies, even smaller emergencies. What's happened if my dad and mom, and I'm 6 years old, actually caught fire in the kitchen and they cannot reach the telephone? What happens if we don't teach children at the age of 6? I mean, this is in part some sort of engagement, basically the health literacy at that level. The second thing is to be honest with you, I'm honest with your population. First of all, today, tell them what the resources is available to you, And thirdly, I mean, I'll just go quickly through these examples. Make yourself available to the community as a leader, appear in the newspaper, talk in the local media, I remember, I'm not showing off, that I and the team working with me, they know that I used to spend 40% of my time in the street of London. 40%. with my team. We go and talk to the people sitting in cafes, sitting in bars, sitting in restaurants, you know. We introduce ourselves to big businesses, etc., to small, asking them if they need any help. So you are available to them. You shouldn't be somebody in ivory tower. You should be a part of the people, you know, exactly like local police shouldn't be in the car, should be actually on the street, on the pavement of the city they serve, and the village they serve, and so on and so on.
Thank you. I see another raised hand, so maybe to have a last question before we wrap up. Just to see the name of this participant, Najibullah. Can we have Najibullah?
And you have
Muted
Anchor.
now. Okay, or we have another hand that just was raised. So many questions. Ankur Verma, Dr. Ankur Verma, maybe unmute yourself and please go ahead with your question.
Hello. Hello.
Yes, sir. Hello. I
Yeah.
can hear
you. Sir, I am about to graduate as a public health in my master's. So I'm actually finding ways or navigating my path through public health. I'm really uncertain about emergencies right now, but yeah, I'm looking to get a grip of things. And this has been a very nice and I would say enlightening session for me. So I just wanted to thank you and wanted to know the right way to move forward. I'm really sorry if I'm putting a wrong step here, but it would be really helpful if you could give me some tips.
you said you are studying MPH, are you?
I'm completed my
You
public health
completed your
master.
MPH,
Yeah.
So welcome to the troop of public health, and I'm sure you will do a great job. You see, the best things, to be honest with you, to learn about emergency preparedness and response is to be a part of the emergency team at local level. It's a great opportunity. This is not about something which you read it in a textbook or you listen to Salman Rawaf or Samar or Celine or Maria. It's bigger than that. You need to be part of the team because number one, preparing for emergency plan, which is called emergency planning, is a very complex process because it look at the local resources, it look at the stakeholders, it's about identifying people and the role and the expertise, etc. Basically, you are looking in depth at each organization capacity and ability and what they need to do in terms of a crisis. Take it to the second stage and part of the now from planning to preparation is how we make that happen. So we do a drill, as I mentioned in the lecture, how important the drill and engaging the population, participating in that process is as important as preparing, you know. And thirdly, I'm sure you will be involved in small emergencies at local level, and you will learn how to respond. And we hope that there will be no major national or regional or global emergency, you know. So, but to prepare for this at the same time, things goes hand in hand. You look at the IHR, International Health Regulation of the WHO, although now a new set will be available soon, I think. We are waiting for it for some time, and I think COVID changed the whole picture, and we believe we may have different outcomes soon. Look at the literature in terms of analysis of some of the local outbreak, major, recently there were a few papers about the earthquake in Turkey. It's worth looking at. I'm sure we will have something soon in terms of what happened in LA. So both practice and preparation and reading and exploring other experiences.
Thank you, sir. Thank you so much.
Welcome, sir.
Thank you. I think it's time to conclude our Q&A session. There were a lot of great questions, and thank you very much for this engagement. I will now hand it over to Dr. Samar to wrap up this session. Over to you, Samar.
So, Dr. Salman, I think me and participants cannot get enough of your experience. We need more, and we want more. Actually,
At your service.
I regret it's only 1 hour. So I think we will plan for another session soon, especially when you talked about the situational leadership or the dynamic leadership. I think we need such a thing. We need to know how to change between the leadership styles and how to learn more about adaptive leadership. As you rightly said, leadership, yeah, it might be born. Someone might be born with the leadership skills, but we need to be trained. Everyone needs to be trained and to develop his or her own skills. As I said, I think myself, I need another session, Dr. Salman, and I'm sure so many people, they will ask for another session too. With that, I would like to thank you, Dr. Salman, for the time, for the experience sharing, for the expertise, for the humble way of showing your leadership. Actually, that's very appreciated. I want to give also the floor to Celine if she wants to compliment. Celine, she is also a hidden soldier behind all of this. So Celine, over to you.
What's happened to Salim?
Sorry, I was cut off. No, but I just want to say a huge thank you for everyone involved behind the scenes at the webinar. Thank you so much, Maria, Dr. Samad. And we are all your students, Professor Salman. We always learn, and I always learn with every session, even though I'm with you every day. It's always a learning opportunity from my end. So I just like to thank everyone. And thanks for everyone, all the participants, and hopefully we'll be able to see you soon in collaborative opportunities. Thank you.
Thank you very much. Thank you, everyone. I'm so grateful for your presence. Love you all. Take care and be safe.
Thank you, Dr. Salman. Thank you, Rochelle. Thank you, Maria. Ramzi and Maria Popovich. Thank you, everyone, and see you soon in 2 weeks' time. Heartfelt appreciation for you, Dr. Salman, and for your time. I really appreciate it. Thank you.
You're welcome. Thank you very much. Thank you, Maria. Thank you.
Thank you very much. Bye-bye. Have a great day. Bye.